All right, this is just going to be a quick overview of the cranial nerves. So we have cranial nerve 1, olfactory, 2, optic, 3, oculomotor, 4, trochlear, 5, trigeminal, 6, abducens, 7, facial, 8, acoustic, 9, glossopharyngeal, 10, vagus, 11, spinal, and 12, hypoglossal. So that is a lot to take in. So we have some acronyms for us. So to just remember them in order, we have once one takes the assessment final, a good vacation seems heavenly. So that's just to remember the numbers. You can go through that in your head. And then, when we want to remember if they're sensory or motor or both, which is called mixed, we can remember the acronym. Some say Minnie Mouse might motivate Mickey, so Mickey might move more. So the S's, like some say, mean it's a sensory nerve. MI, such as Minnie, might, that is, or Mickey, that is a mixed cranial nerve function. And then MO, such as mouse, move more, those are motor functions. So again, that's some say Minnie Mouse might motivate Mickey, so Mickey might move more. All right. And then also the acronym for the cranial nerves. Once one takes the assessment final, a good vacation seems heavenly. So that's also a fact. All right, so one way you can also remember the nerve's functions now is doing the face. So I can do that. So we're going to start with cranial nerve 1. So O, as in once one takes the assessment final, a good vacation seems heavenly. So O is olfactory nerve, and that is our nose. 1. So olfactory, and then we can think some say for the function, so we know olfactory can be tested, and it is sensory, motor. I'm sorry, sensory, not motor, just sensory. And you can use that. It's not usually tested unless the person says that they are having trouble smelling something, or if they have anosmia, so then you can just occlude one nostril and put a familiar smell and do the other nostril. So that is cranial nerve 1, olfactory. Cranial nerve 2 is optic, getting ahead of myself. So cranial nerve 2 is optic, and that is located behind the eyes, and that is responsible for central and peripheral vision. So you can that can be used using the Snellen chart for central vision, or having the patient read their IV bag. And then you can have them count how many fingers are in front of them. So I guess that's if they're in a bed and the Snellen chart's not available. And then peripheral vision, you test one at a time as well, having them cover one eye and having the patient look straight ahead at your nose. And then you take your fingers and come in from the side as you also cover one eye. And if you have good vision, then they should be seeing your fingers when you are. So that is optic nerve. So that's 2. All right. And then we have cranial nerve 3. So once one, another O. So it's not olfactory, not optic, it's oculomotor. And then we can say, some say Minnie, so we know it's going to be a mixed. So ocular motor is also going to be about the eyes, and that is, it controls pupillary constriction. So to test this, the patient's pupils, you want to dim the lights, and in the exam for our performance test, you want to state that you would dim the lights. And then you bring the pen light in from the side to the center of each eye, noting the response. And then you can say what the pupillary size difference was. Um, that is oculomotor nerve 3. You can also check where the eyelid falls on the pupil. If it's drooped, I may have ptosis. So it's easy to check cranial nerve 3, 4, and 5 together. So 3 is that pupillary reaction again. So this is also the eyes. So we're going to give them a little eyebrows. All right, so then number 4 is trochlear nerve. So O once 1 takes trochlear nerve. Now just be careful because it's 3 O's and then 2 T's. So you want to remember it's olfactory, optic, oculomotor, trochlear, and then trigeminal. So trochlear, some say Minnie Mouse. So MO, it's going to be a motor nerve. So that is also connected to the eyes. It's moving the eyes down towards the tip of the nose. It's the nerve acts as a pulley to move the eyes down and in. So we can put them over here. Oops. So the eyes are looking down towards the nose. That's number 4, trochlear nerve. So we can go back to O once 1 takes the other T. So it's not trochlear, but it's trigeminal. And that is cranial nerve 5. And that covers most of the face. You can check the sensation. Well, okay, cranial nerve 5. So some say Minnie Mouse. Okay, some say Minnie Mouse, some say Minnie Mouse might. M-I, so it's mixed. And we're going to draw the 5. Takes up a lot of the face. So you can do, it's mixed, so there's 2 tests. So for sensory, we do the cotton ball light touch on the face. And then for motor, you assess the jaw opening strength. All right. Now cranial nerve 6. So O once 1 takes the assessment final. Oh wait, O once 1 takes the assessment A, abducens. And then we can think, some say Minnie Mouse might. Motivate. So M-O, motor. So abducens is motor. So cranial nerve 6. That also has to do with eye movement. And that is eye movement to the sides. So you can have them follow a pen light. So you can assess if they can move it to the sides. So we're just going to give them all 6. Okay. So now to cranial nerve 7. O once 1 takes the assessment final. F. So that's going to be facial. And we can think, some say Minnie Mouse might motivate Mickey. M-I. So it's going to be mixed. So facial. It's going to be 7. Big old face. All right, so I said it's going to be mixed. So 2 ways to check that. You can assess the patient for facial symmetry, and then you have them wrinkle their forehead, close their eyes, smile, pucker lips, show teeth, puff out cheeks, and you can notice any folds or weakness or flattening when they're smiling or frowning. You can assess the patient for facial symmetry while they're making those movements. All right. Now 8. I think of 8 ear acoustic. 8 is going to be near your ear. So once 1 takes the assessment final, A, acoustic. And then let's think. Some say Minnie Mouse might motivate Mickey, so Mickey will move more. So S, so it's going to be sensory. So we're going to give the face some earrings or ears. So that can be tested by the whisper test, or moving your fingers next to their ear and seeing if they hear it. Just make sure you're not touching their hair or anything. All right, so that was 8. So now number 9. Once 1 takes the assessment final, A, good. So G. So it's going to be glossopharyngeal. And now we can think. Some say Minnie Mouse might motivate Mickey, so Mickey will move more. So Mickey, M-I, it's going to be mixed. So we're going to see this on the back of the tongue, glossopharyngeal. Okay, I wrote that backwards for the camera. There we go, glossopharyngeal. So we can actually test 9 and 10 and 12 really together. So these cranial nerves, 9 and 10, innervate the tongue and the tongue and the throat, so the pharynx and the larynx. So you can assess taste in the back of the tongue. You can observe the patient's ability to swallow, which is 9, by having them open their mouth, taking a sip of water and swallowing. And then number 10, you can ask the patient to open their mouth and say, ah, ah. And if you see the uvula rise up in the palate in the back, that's what is expected to be seen. So also, we can skip for 11 for just a second and go down to 12, because 12 innervates the tongue. So when you have them stick their tongue out and say ah, you can also look at the tongue, see its midline, and observe if they're having any problems with swallowing or speaking. So then going back to 11, we can think, okay, 11. Once 1 takes the assessment final, A, good vacation seems, so S, and that's going to be spinal. And then some say Minnie Mouse might motivate Mickey, so Mickey moves. Some say Minnie Mouse might motivate Mickey, so Mickey might move more. I was like missing a word. So move, M-O, so spinal is going to be motor. And it's going to be 11. 11. So that's going to be shoulder and neck. Draw them a little collar. All right, shoulder and neck. You can test that by putting your hands on the patient's shoulders and having them press up against resistance, and then putting your hands next to the patient's head and having them turn against resistance to test for the neck. And that was motor. Okay, so now going back to 12, we can think, once 1 takes the assessment final, A, good vacation seems heavenly, H. So 12 is hypoglossal. And then we can think, some say Minnie Mouse might motivate Mickey, so Mickey might move more, M-O, motor. So that's when they stick their tongue out. And those are the cranial nerves. And this makes a little face to help you, because remember, 1 olfactory, 2 optic, 3 ocular motor, 4 trochlear, 5 trigeminal, 6 abducens, 7 is facial, 8 is acoustic, 9 is is glossopharyngeal, 10 is vagus, 11 is spinal, and 12 is hypopharyngeal. I always think also 10 Vegas, so you can think, oh, Vegas, a 10 out of 10 vacation. Never been there, but it's just a thought. So there's the face again. And again, the mnemonics are O once one takes O once one takes the assessment final, a good vacation seems heavenly. And then for function, some say Minnie Mouse might motivate Mickey so Mickey might move more. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, acoustic, glossopharyngeal, vagus, spinal, hypoglossal. And those are the cranial nerves and how to remember them.